You're watching KWTX News 10.
Welcome back. Well, now you might be very surprised by this, or you might think, well, this doesn't seem right, but even your newborn babies can get chiropractic care. We have Dr. Jason Raesz with Advanced Chiropractic with his little, just about 2-month-old daughter, Kaylee, to show us how this exactly works. So thank you for being here today.
Thank you, Marlena, for having me on.
And she is just so adorable.
Thank you so much. Yes, thank you.
All right, so yeah, tell us kind of a little bit about this.
Yeah, so I adjusted her the night she was born.
Wow.
And so she's been getting chiropractic care every other day. I check her spine and get her adjusted. And it's because I want my little girl to be super healthy, right? And I'm sure there's not a parent out there that doesn't want their child to be healthy. And you know, health really starts with the nervous system. And so her little brain right now is communicating with her entire body, you know, and all these cells are replicating and growing. And of course you can tell she's a really healthy baby, and she's grown a lot in 2.5 months here. And so, you know, I want to make sure that it's the brain and the nervous system are working at 100%. So whenever I adjust her, I check her little neck, I check her little back, I adjust her little low back and hips. And I'm going to do that for you guys here in just a moment. And it's just, you know, it's real gentle. And babies, they don't even make a peep, or they don't even, most of them don't even cry. Now, I have adjusted kiddos that do get some, you know, fussy sometimes when I adjust them. And usually that's just because they don't know me, and because I'm a strange guy that's adjusting them with a beard, and you know, they're not used to that. And so, but most babies, they get adjusted and they do great. And so now some of the things that you might want to get your baby checked for, if of course get them checked just to get them checked because you want them to be healthy, but babies that are real colicky, you know, babies that are fussy all the time, you know, they might have a little misalignment in their spine putting pressure on the nerves that's causing interference, causing discomfort, and it's keeping them from being able to sleep at night. If they have ear infections, if they have a lot of allergies, if they're kind of sickly babies, you definitely want to get them in and get them checked so that we may be able to help them. And if you allow the mom to get a little extra sleep at night, it can be a world of difference for the mom.
Definitely. All right, so let's kind of see how this is done. And if someone has any just reservations about this, what do you kind of talk to parents about to kind of ease the nerves of you know, you letting them?
Absolutely. Well, I'm glad I'm on TV here today so I can show you how easy it is. And then going forward here, I'll have this news clip and I can tell them to watch the news clip and see how easy it is. But of course, we just kind of talk to them about what we're going to do and how gentle it is before we ever adjust the child or them, even an adult. You know, some adults are nervous. And so hopefully any adults that are nervous about getting adjusted, when you see a 2.5-month-old get adjusted, hopefully that'll help to ease your fears as well. But what I'm going to do is I'm just going to lay my daughter right here on her changing pad, and I check her neck. So right now I'm just going to press into her little neck, and you know, if she has a misalignment, we'll just do a real gentle, light adjustment. There we go. And then we check her little hips, and so you know, it's pretty similar to the way we adjust adults, except for it's a lot more gentle. So whenever we adjust her little hips just like that, and then we'll spin her over, and we'll adjust her this way as well. Good. And then for her, because she's my special little baby, and give her a little kiss. And then, you know, we also can check her little back, her middle back, because the middle back can cause like asthma and cause difficulties breathing. So, you know, whenever I adjust her little back, if I feel any misalignments, I just apply a little pressure and get the pressure off those nerves. And sometimes when I adjust her, you know, it really gets her digestive system working. You know, so if a baby is constipated, I'll adjust her and I'll immediately hear her start to toot or to go to the restroom, which is really healthy. You want the body to be functioning, right? You want the body to be pushing the digestive fluids and everything out. So, you know, if there's any interference, I want to remove that so this little princess can be super healthy.
And like you were saying, if you start this young, then the benefits as you get older is just a world of difference.
Absolutely. So if you have a misalignment, we call them a subluxation. So if you have a subluxation of the spine, then it's gonna, you know, it's gonna cause degenerative problems down the road. And the earlier you get them checked and get them corrected, the better off you're gonna be when you're an adult. Or, you know, if you haven't got checked and you are an adult, the sooner you get in and get checked, the better off you're gonna be.
Definitely. And so, yeah, if someone wants to bring their baby in or try it out, we're doing a special. If you mention KWTX News 10 to 3. Can you tell our viewers what that is?
Absolutely. So we have a special, and it's not just for babies. It's for anybody that wants to get checked and to find out if their spine is working right. The special is if you call into the office, which our number is 254-778-2225, and if you call in and say you saw Dr. Raesz on KWTX, then we're offering a special where you can come in, you get a consultation, you get the entire examination, you get a set of x-rays if you're an adult, and then we go over those x-ray findings, we go over those exam findings with you one-on-one, and that normal fee for all of that is normally $226, but for our viewers today we're doing it for just $59, as long as you mention that you saw Marlena and I on KWTX.
Oh, perfect.
Yes, ma'am.
Well, thank you, Dr. Raesz and
Hey,
little
you're welcome.
Kaylee for coming on, and this was absolutely amazing and very, very neat to learn.
Yes, ma'am. Thank you so much. I appreciate it.
All right, we'll be right back.
I